On lesson 12, we're going to talk about systemic infections. It means we're going to talk about infectious diseases that affect cardiovascular and lymphatic systems. And as always, we start with the brief review of anatomy, and we start with anatomy of cardiovascular system first. So, our cardiovascular system carries blood from the heart to the peripheral tissues and organs, and this is where gas exchange occurs. The deoxygenated blood from peripheral organs and tissues will be exchanged for the oxygenated blood coming from the lungs, and then deoxygenated blood will be carried back into the heart and then pumped into the lungs. And once again, this is the second gas exchange occurs over here, and carbon dioxide from deoxygenated blood in the lungs will be exchanged for the oxygen from the air. The cardiovascular system consists of heart, blood vessels, and blood. Now let's talk about our heart. It has 4 chambers in the structure. The upper 2 chambers are called atria, and the lower 2 chambers of heart are called ventricles. There are valves that are located in between atria and ventricles, and also between chambers and blood vessels. The main function of those valves is they prevent the backflow of blood. The cardiovascular system is composed of 2 circulations, pulmonary circulation and systemic circulation. And this is the areas where actually gas exchange occurs. Let's go to the next slide and look how blood actually moves through cardiovascular system and how gas exchange occurs. Let's start with the left ventricle. The oxygenated blood leaves our left ventricle through the largest blood vessel, which is called aorta. Aorta has very thick walls that are made of or composed of 3 layers, and also aorta has the highest concentration of oxygen in the blood. From aorta, blood moves to arteries, still pretty large blood vessels with the thick walls, and then it keeps moving, and arteries will branch into arterioles, the smaller blood vessels with the thinner walls. Eventually, arterioles will be branched into capillaries, and the capillaries are the smallest blood vessels with the thinnest walls. This is where gas exchange occurs. The carbon dioxide from peripheral organs and tissues will be exchanged for the oxygen that comes from the air. Then the deoxygenated blood will be collected from the capillaries and carried back into the right atrium through vena cava. And after that, blood from the right atrium will move into right ventricle. From the right ventricle, deoxygenated blood will be pumped through the pulmonary arteries back into the lungs, and this is where the second gas exchange occurs, and the carbon dioxide from the peripheral organs and tissues here will be exchanged for the oxygen from the air. And then from the lungs, oxygenated blood will be collected and moved into the left atrium through the pulmonary veins. And then from the left atrium, it moves to the left ventricle, and then will be again pumped into aorta from there. Now let's talk about how do we name blood vessels in the cardiovascular system. When we talk about peripheral circulation, we always say that arteries carry oxygenated blood, when veins carry deoxygenated blood. When we speak about the heart, it's a little bit different. Please remember, every time when our heart receives blood, it receives it through the veins, even though sometimes it's deoxygenated, for example, vena cava, or sometimes it's oxygenated. An example will be pulmonary veins. Every time when blood leaves our heart, it leaves it through the arteries, and sometimes it's oxygenated blood, for example, aorta, but sometimes it's deoxygenated blood, for example, pulmonary arteries. Now, lymphatic system also is called immune system, and actually it has two functions. First of all, it fights microbial infections and protects us. And the second function, it recovers fluid that is lost in the peripheral tissues, and lymphatic system actually returns it to the bloodstream. So we can say that one of the functions of lymphatic system is to prevent development of edema. Let's talk about these two terms that we use widely every time when we talk about infections of cardiovascular and lymphatic systems. The first term is transient bacteremia. It means bacteria gets into the bloodstream for the short period of time, and usually because it's just a presence of bacteria in bloodstream for a short period of time, they don't stay there for a long time, do not grow, do not multiply. Usually this condition is asymptomatic, and every time when we get infected with any type of bacterial infection, we always go through a brief transient bacteremia. Another term that we're going to use also is septicemia. Septicemia means infection in the blood. It means bacteria stay within the bloodstream, grow, multiply. As a result, patients develop symptoms of what we call sepsis. And of course, it is a dangerous condition and requires antibacterial treatment as soon as possible. And today we're going to talk about systemic infections. So those are body-wide infections. It means infections that affect cardiovascular and lymphatic systems. And we start with infections that affect our heart. Different areas of our heart can be infected, and how we can divide all those infections based on their location into three groups. The first group we call endocarditis. Endocarditis means infection or inflammation of endocardium. Endocardium is the most inner layer of our heart, and it is very smooth inner lining, including heart valves. Endocarditis can be caused by bacteria, by fungi, and viruses. The main symptoms of endocarditis will be fever, fatigue, anemia, and if heart valves are damaged, then patients will develop a specific symptom, which is a heart murmur. Of course, if the damage is extremely severe, very severe, it can lead to the heart failure. Next syndrome is called myocarditis. Myocarditis means infection or inflammation of myocardium. Myocardium is a middle layer of our heart, and it is actually heart muscle. Myocarditis can be caused by viruses, bacteria, fungi, and protozoa. The symptoms of myocarditis will be tachycardia or irregular heartbeat. Chest pain, it's a more specific symptom for adult. Children usually don't have this complaint on the chest pain, but they become not as active as they usually are. And of course, it also can lead to the heart failure. And finally, the last syndrome is called pericarditis. And pericardium, it's a smooth membrane that surrounds our heart from outside. And there's a space between pericardium and our heart. We call it pericardial space. The infection of pericardium, pericarditis, can have viral origin and also can be caused by bacteria or fungi. But please remember, the most dangerous kind of pericarditis will be a bacterial pericarditis. Why? Because as you remember, bacterial infections produce pus. If there's accumulation of pus in pericardial space, it can lead to what we call tamponade. Tamponade means pressure on the heart caused by pus. As a result of tamponade, as a result of that pressure, our heart might stop. So let's talk about endocarditis in a little bit more details. As I said, endocardium, it's a very smooth layer of connective tissue. And usually pathogens are not able to stick to that very smooth surface. But sometimes endocardium might get damaged as a result of some kind of congenital defects or as a result of some kind of infection or inflammatory reactions. So when endocardium becomes not as smooth like it's supposed to be, then some bacteria have ability to stick to those rough surfaces, grow and multiply. And then over the time, those bacteria will be covered with the clot-like material from the blood, and this is what we call vegetation. Vegetations can grow, and also please remember there is a very dangerous complication of those vegetations when they can detach from the surface of endocardium and then travel through the bloodstream. Now we call them emboli. Emboli can block blood vessels in different areas and cause infarctions. For example, in the lungs, in the kidneys, in the heart, in the brain. So as I said, that is a very dangerous complication. Endocarditis can be subacute and acute. Let's start with the subacute bacterial endocarditis. Usually it's caused by Streptococcus viridans, which is alpha hemolytic strep. Like all streps, Strep viridans is gram-positive coccus in chains. As I said, it produces alpha hemolysis on the blood agar plate, and it is a part of normal biota in our mouth. Because Streptococcus viridans is a part of normal biota in the mouth, it means every time when we have our teeth cleaned, it can get into the bloodstream for a brief period of time. This is what we call transient bacteremia. But for healthy individuals, this condition is not life-threatening and not dangerous because, as I said, transient bacteremia, it's a brief condition, and usually bacteria don't stay there in the bloodstream and don't grow and multiply. And because in healthy individuals endocardium is smooth, bacteria won't be able to attach to those smooth surfaces. But if patient has some kind of congenital or acquired heart defects on the surface of endocardium, then bacteria can attach to those defects, grow, multiply, and form what we call vegetations. Therefore, there is a rule in dentistry. If patient has some kind of heart problems or defects, that patient is supposed to take antibacterial treatment before he has teeth cleaning procedure and after teeth cleaning procedure. Uh, what are the symptoms of subacute bacterial endocarditis? That is not very aggressive type of endocarditis, and usually patients develop fever, fatigue for several months, and might develop heart murmur. Acute bacterial endocarditis is more serious than subacute. Usually is caused by Staphylococcus aureus, remember, gram-positive coccus in clusters, or Streptococcus pyogenes, again gram-positive coccus in chains. Usually can be seen in drug users. And as I said, it's more dangerous condition. It has sudden onset and progresses rapidly. The treatment of acute bacterial endocarditis should be started with antibacterial drugs as soon as possible. But most of the times, because this infection has sudden onset and progresses rapidly, most of the times, even with the best antimicrobial treatment, the heart valves of those patients will be damaged, and the only way for us to fix that problem will be replacement of damaged heart valves. Myocarditis is infection of myocardium. Most cases of myocarditis here in the United States are viral myocarditis, have a viral origin, and usually this type of myocarditis is caused by the same viruses that cause respiratory tract infections. Patients usually develop symptoms of myocarditis on the third or fourth week after they recovered from infection, and patients usually develop mild symptoms, for example, fatigue, rapid or slightly irregular heartbeat. There is no specific treatment for this condition. Those patients are recommended to take easy, have a lot of rest, and usually most of the patients recover without any problems within a few weeks. Also, myocarditis can be caused by certain pathogens from, for example, protozoa. And we're going to talk about Trypanosoma cruzi next, which is caused what we call American trypanosomiasis or Chagas disease. This infection is common for South America, and it is transmitted by what we call kissing bugs from the animals. Why do we call those kissing bugs? Because they bite people in the face. Chagas disease has two stages, an acute stage and the chronic stage. The symptoms of acute Chagas disease, patients usually develop in 1 or 2 weeks after they've been bitten by kissing bugs. During this stage, a lot of protozoa can be found in the bloodstream, so it's very easy to diagnose. This infection is an example of systemic infection because protozoa spreads into the brain, liver, myocardial cells, and patients develop symptoms of systemic infection, which are fever, fatigue, swelling of face. And this stage is not deadly stage of American trypanosomiasis. It can be treated and can be cured with anti-protozoal medications. But if patient is not treated during the acute stage and develops symptoms of chronic stage, that means pathogen spreads from bloodstream into lymphatic system as well, and in this case, pretty much every system, every tissue will be infected. When it actually causes damage of myocardium, it causes very severe myocarditis, and it can lead to heart failure and death. And the last infection of the heart is pericarditis, infection or inflammation of pericardium. And the most common pericarditis here in the United States is a viral pericarditis, and usually it's a complication of respiratory tract infection and caused by the same viruses that cause respiratory tract infection, for example, enteroviruses. As I said, bacterial pericarditis is more serious. Usually it's caused by Streptococcus species or Staphylococcus species. And remember, as I said, bacterial infections are more serious because they produce pus, and when pus get accumulated in pericardial space, it can cause pressure on the heart. We call it tamponade when heart just simply stops. And also, actually, it can cause damage of